open it up to the panel. We have a few more minutes. Does anybody on the panel want to say some final comments? Dr. Salmon, I would like to. Sure, there you go. Dr. Salmon, can you? Sure, take a minute for sure. Doug, did you hear that?
I forgot to unmute, but thank you for the opportunity. So a couple of initiatives I just wanted to make people aware of, and they can certainly be in contact with me if they have an inkling towards either of these. So one of the things that we are working on with one of our outcome measures is an early warning system. This is one of our projects in conjunction with University of Toronto Scarborough, such that it's an online-based application whereby as individuals who are involved in work would be checking in on a fairly regular basis, reviewing how they're doing functionally as well as reviewing their symptoms. And the idea is that if somebody's becoming increasingly symptomatic, the early warning system would raise a red flag, and then it would end up being something that could facilitate more rapid clinical intervention. The other project that we are now considering, and this basically is born out of a social enterprise tour that I did with David LePage in Vancouver last year, where it became quite evident that many social enterprises working in the space were disadvantaged by really having very little clinical or vocational information on the clientele. On a professional basis, we do very extensive neurovocational assessments and cognitive and psychological job demands analysis in workplaces and similar assessments of individuals. Obviously, in this context, that's too expensive, but we're thinking of, again, a potential online profiling where we could have a better sense of clients' cognitive strengths and weaknesses, interpersonal strengths and weaknesses, potential triggers, accommodations, and the like. And these would then be matched against a resource database of similar profiling of social enterprises working in the mental health sphere. So we'd have a sense in terms of what kinds of social enterprises are better fit given different cognitive and interpersonal profiles. The example that Lori gave of somebody perhaps working in cleaning, that might work out better for them because it's a later evening thing. It might not involve a lot of social interaction. We could have that resource base, and then social enterprises potentially, and we could choose what's the best fit for clients, and there could be referrals back and forth as a certain client comes in the door at a social enterprise, but whereby that enterprise feels that this individual could be better served at a different mental health based social enterprise. So if folks are thinking, agree that this is an approach, we're certainly interested in hearing from folks and doing some piloting of these kinds of.
Thanks very much, Doug.